Welcome to Maestro Conference. Please enter the conference. This call may be recorded. Thank you. You will now be connected.
Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have at least 129,288 lab-confirmed cases, 1,167 people in the hospital, and 2,050 people who have died. Since our last COVID-19 update, North Carolina has passed the solemn benchmark of 2,000 people who have died from this virus. Every single one of them represents a family in mourning and a community grieving their loss. They are more than numbers on a chart. They are North Carolinians who are missed dearly, and we continue to pray for their families. Before I update on COVID-19, I wanted to share an update on recovery from Hurricane Isaias. I traveled this morning to Bertie County, where the storm spawned a deadly tornado, leaving 2 people deceased, about a dozen people injured, and a trail of devastation behind. I thank the rescue teams who went in overnight to assist people who were trapped and who got people to medical care. Their heroic efforts make us all proud. And I saw some of the most heavily damaged areas. This storm flattened parts of Bertie County, and we must be there to support their recovery as they put their community back together. Tomorrow, I'll visit southeastern North Carolina that experienced destructive storm surge and winds. A hurricane on top of a pandemic is cruel, but our emergency managers and first responders were prepared to handle both crises at once, and our people are showing their resilience. Throughout, North Carolina continues its fight against COVID-19. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will walk us through the data and our key metrics. Dr. Cohen.
Thank you, Governor, and thank you for your leadership under multiple crises. Before I begin with data, I just want to give a shout out to the state of Missouri for voting yesterday to expand Medicaid. We in North Carolina are now one of only 12 states that is not saying yes to providing North Carolinians with affordable access to health coverage and bringing billions of dollars into our economy. It is time to expand Medicaid here in North Carolina. All right, it's data day. My glimmer of hope remains as we see subtle signs of progress. Again, this is a testament to the hard work people have been doing across the state, from our healthcare workers providing care in extreme weather conditions, to the labs who have brought down test result turnaround times, and to the many North Carolinians who are always wearing a face covering in public. Thank you. But as we see viral transmission levels start to stabilize here in North Carolina, across the country and around the world, many places are experiencing exactly the opposite, trends that are going in the wrong direction after a rushed reopening. Here in North Carolina, we continue to take a measured approach, making decisions based on the best available evidence and data that we have. All right, let's talk data. As a reminder, we use a combination of metrics that we look at over a 14-day period. We look at COVID-like syndromic cases, lab-confirmed cases, positive tests as a percent of total tests, and hospitalizations. Some of these indicators help us understand the rate of viral transmission in the past few days, while others, like hospitalizations, tell us how much transmission was happening a few weeks ago. As we go through our data today, you'll notice that the graphs only go through Sunday of this week. We identified a reporting omission from a few labs when doing a quality check today. We will be posting revised data for new cases and the percent of tests that are positive for the last 3 days. But let's dive in. Our first graph looks at people who come to the emergency department with COVID-like symptoms. This is the most timely data we have, and it's our earliest detection mechanism. This metric is not impacted by testing rates or other factors. So take a look at that yellow line. You can see that that trend is declining. But you can also see that that yellow line is still high above its baseline. Next, we look at laboratory confirmed tests. This is another one of our more timely metrics. This first graph gives you a look at that trajectory of new cases each day since we had our first case all the way back to March. But let's zoom in to get a better sense of the current picture. On this graph, we now see another week of evidence that shows we are starting to stabilize, but the rate of those cases is still high. Now we look at the percent of tests that are positive, and looking at that yellow line, you can see the percent of total tests that are positive is generally level, and now we're hovering between 7 and 8%, though we want to see that closer to 5% or less. On our next slide, our dashboard, we look at our daily hospitalizations. As I've mentioned before, people who are going into the hospital today were likely infected days or weeks ago. That's again why we call this a lagging indicator. This trend will take longer to stabilize than other metrics. When we saw our cases started to level, we discussed that it would take a few weeks for our hospitalization data to reflect that trend. And now we're seeing the first signs that hospitalizations may be leveling off as well. Fortunately, we still have adequate hospital capacity here in North Carolina, and we continue to monitor those capacity levels closely. Okay, so here is where we are. Our surveillance data is declining, but it remains elevated, so it gets a yellow line. North Carolina's trajectory of lab-confirmed cases is stable, but the number of cases remains high, it gets a yellow line. North Carolina's trajectory in percent of tests returning positive is hovering around 7 or 8%. This gets a yellow line, as we'd like to see it closer to 5%. North Carolina's trajectory of hospitalizations is beginning to flatten, and we continue to have enough capacity. This gets a yellow line. We also track our critical capabilities, our ability to respond to this pandemic, and you will see that testing has a sideways arrow. While testing turnaround times, as I said, have improved, we have seen fewer tests done over the past week. So we want to encourage anyone who needs a test to get one, particularly those who may have been to a large gathering or work in a higher risk job. There are many sites across the state that provide free testing. Please visit our website to see a list of community testing events that the state is deploying to increase access to that free testing, particularly in communities that have been historically marginalized and may have not had access to testing in the past. On contact tracing, we continue to hire contact tracers to bolster the efforts of our local health departments and to meet their ongoing needs. Our PPE supplies remain stable. We're continuing to distribute PPE across the state, and as of now, we've distributed more than 3.5 million cloth face coverings, 4.5 million procedure masks, and significant amounts of additional personal protective equipment to support facilities that conduct essential public functions, including schools and childcare facilities and courthouses. and as well as to settings with higher risk for COVID transmission, such as nursing homes and agriculture facilities. One additional slide for you. As we begin August, we have a new round of openings. As you can see on the map, about half of our K-12 school districts will be offering some form of in-person learning this fall, as indicated by Plan B. And right now, across our state, institutions of higher education, including our 16 UNC system universities, are welcoming students for the fall semester. Our department has worked hard with administrators, students, teachers, and staff to prepare for students' return with strong prevention and safety measures. Our official guidance is designed to limit the risk of transmission, but cannot eliminate every element of risk. For that reason, school openings are a significant phase in our response. It's a new phase in our response, and we'll continue to closely monitor our trends and data in light of these changes during the days and weeks ahead. So while overall we're seeing signs of stability, we still have much work to do. Our recent trends show what is possible when we commit to slowing the spread by wearing face coverings and follow those simple but powerful 3 W's. As North Carolina's COVID-19 response continues, we all need to do right by our students and protect our communities. Everyone can help set North Carolina students up for success by wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. The 3 W's: wear, wait, and wash. Thank you, Governor.
Thank you, Dr. Cohen. As I said last week, stable is good, but decreasing is better. And while we are seeing stabilization of our numbers, that doesn't mean we can let up. We know this stability is fragile, and these trends can change quickly if we let down our guards. You only have to look at hospitals in other states that have been overwhelmed when reopening occurred too fast. In North Carolina, we've used the dimmer switch approach to easing restrictions. This ensured that we did not open too much, too quickly, which health experts say can lead to a devastating increase in cases, sickness, and death. In addition, it can lead to having to go backward, like some other states have had to do. There are key openings already occurring this month, as Dr. Cohen said. August means back to school time for our K-12 students, as well as our colleges and universities. But it's not business as usual this year for our schools. Most of our students will begin school using remote learning, but others will have some in-person instruction. However, there will be fewer children in the classroom at one time, mandatory mask wearing, and social distancing. A number of private schools are starting back with in-person instruction as well. And our college campuses will have students, but they'll be using more buildings and less in-person instruction because of the pandemic. The opening of schools and colleges is an important one. Education must go on, even in a pandemic. In-person learning has benefits, but it means challenges for our state, especially as our higher education campuses draw students from around the country and the world. With the hustle and bustle of opening schools, people will move around more, and so will the virus. Other states that lifted restrictions quickly have had to go backward as their hospital capacity ran dangerously low and their cases jumped higher. We will not make that mistake in North Carolina. In keeping with our dimmer switch approach with school openings, and in order to push for decreasing numbers, which will keep people healthier and boost our economy, North Carolina will remain paused in Safer at Home Phase 2 for 5 weeks. Experts believe our mandatory mask order stabilized our numbers. And just last week, we added a curfew on alcohol sales to keep restaurants from turning into bars, which are high transmission areas. Our success at returning thousands of students, teachers, and staff safely to classrooms this month depends on us doing what works. Most North Carolinians across the state are doing their part to slow the spread of COVID-19, wearing a mask, waiting 6 feet apart, and washing hands often. These simple strategies are more important than ever. It's time to double down on them. The more people do this, the better our health and our economy will be. As I saw the hurricane and tornado aftermath today, families reeling and entire communities still in shock, I also saw that familiar glimmer of hope that shines every time North Carolinians face a challenge. One mom told me that she and her daughter were violently thrown from their mobile home, but were unhurt. Amid losing most of what she had, she was thanking God for her life and the life of her daughter. That's amazing. Whether it's a storm or a pandemic, that kind of hope and our shared commitment to a stronger future will keep us going. Hold on to that hope. Keep wearing your mask and know that these difficult times won't last forever, but our strength and resilience will. Also with me today is Secretary of Public Safety Eric Hooks, Emergency Management Director Mike Sprayberry, our Commander of the State Highway Patrol, Colonel Glenn McNeil, and Department of Transportation Chief Engineer Tim Little. Lee Williamson and Nicole Fox are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media. If you will identify yourself and your organization, we would appreciate it, and we'll take the first question.
Our first question is from Travis Sane with WRAL.
Thank you, Governor. Travis with WRAL. I'm interested in what conversations the administration has had with university officials, and particularly how you avoid a scenario where we reopen the campuses, students come back on, a fairly predictable series of transmissions happens. They shut down, send everybody home again, potentially spreading the virus further and wider in local communities.
The Department of Health and Human Services has recommended extraordinary steps to our universities in order to keep students and faculty safe, and that ought to be a shining star. I'm going to let Secretary Cohen comment on this, as she has had a number of discussions with university officials. Secretary Cohen.
Thank you, Governor, and thanks, Travis, for that question. Yes, we've been working with folks in higher ed for a number of months, working on best practices, putting together guidance, which is posted on our website. Both the CDC and the state has guidance. And in addition, I know all of our colleges and universities have been working through their own operational implementation of that guidance. We were lucky to have steering the ship at UNC until just a few days ago, Dr. Bill Roper, who is the former CDC director, obviously extensive experience in public health, so was very instrumental in putting together those plans. But I think you're right in saying these are not activities with no risk. There is risk. The virus is with us. It is in our communities. And that's why we have to take the precautions of all wearing face coverings that cover our nose and our mouth, avoiding large crowds, doing the social distancing, and washing hands and keeping good hygiene. So I know all of our universities are working to implement that. In addition, if we do see viral spread on campuses, many of them have already worked to develop memorandums of understandings with their local health department to make sure that if viral spread does happen, that we can contain it quickly and make sure it doesn't spread to other students or faculty. Thanks.
Thanks. Next question, please.
Our next question is from Eric Spanberg with the Charlotte Business Journal.
Governor, I'm curious, with this decision to extend by 5 weeks and the reduced scope of the RNC, for example, in Charlotte, you know how much restaurants, bars, hotels, the hospitality industry is hurting. Is there anything that you are looking to do or that you think can be done to help that sector in particular?
Well, obviously, we have continued to allow hotels to be open and restaurants to be open at reduced capacity and many retail stores to be open. And I think a number of those have seen a comeback during this period of time, and I've been heartened to see that many of them are working hard to require masks and social distancing. Obviously, the retailers are open with reduced capacity. So that's a positive thing. The RNC has changed its mind an awful lot. It was going to be in Charlotte, then in Jacksonville, and back in Charlotte again. We remain ready and willing to work with them on a safe convention. The president had insisted to me that he be able to hold a nomination process in a full arena, and we told them we could not guarantee that, but that we would work with the convention in order to be able to hold one that is safe. And our Department of Health and Human Services will continue to work with the RNC to make sure that can happen. Next question, please.
Our next question is from Paul Wolverton with the Fayetteville Observer.
Thank you, Governor. It's Paul Wolverton with the Fayetteville Observer. On Sunday, two of my brothers and I went to a craft beer brewery, and it required masks and social distancing, and the atmosphere there was like having a drink at one of the private clubs that are closed. And the only meaningful difference seems to be that the beer is made on site instead of being shipped in on a truck. And the restaurant bars are pretty much the same thing. So if a bar atmosphere is conducive to spreading COVID, why aren't you putting the hammer down on the craft beer brew pubs and the restaurant bars beyond your 11 p.m. curfew? Or if the restaurants and brew pubs are handling the health rules effectively, why not allow the private clubs and other places to open with safety restrictions?
There is a difference in that these were made, the products are made on site, and in addition, the small number of those craft breweries and wineries presented a strong plan of public safety to the Department of Health and Human Services, to the point that the experts believed that that would work. We have seen what has happened in other states when bars have been opened. Governor Abbott of Texas said that in all of his reopening, the thing that he regrets the most was reopening bars. We know that these are high transmission areas, and that's why that they have remained closed. And one of the reasons we did put the alcohol curfew in place at 11 o'clock is because we were getting information about restaurants turning into bars after hours. The idea here is to slow the spread of the virus and to make sure that we drive down these numbers, and that's what we're going to continue to do. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Thanks for taking my questions. I wanted to ask about the time period of the extension. This one is longer at 3 weeks. Is there, in the past you said that, 5 weeks. In the past you said that 3 weeks is the time to look at the data. Is the 5 weeks because it'll be 4 weeks from K-12 schools opening or the universities? And then also mentioning the RNC and campaign season underway, do you think candidates should be allowed to hold in-person campaign events of any size, and will you at some point?
We will not hold in-person campaign events, and we don't recommend that, particularly when people aren't wearing masks and when they aren't social distancing. There is question about whether these kinds of events would have First Amendment protections, but I think the Department of Health and Human Services would tell anyone that if you're having these kinds of gatherings that you risk spread of the virus, particularly if you don't wear masks and you don't social distance. On the 5-week period, I'm going to let Dr. Cohen address that. We know that our schools are going to be opening in a couple of weeks, and we know that we saw last time that when we went to remote learning in March, we saw a significant decrease aligned with that closing of schools to in-person learning, just because everything slows down. And when schools open back up, even though a lot of students will be in remote learning, things churn back up again, and we know that there will be a lot of movement and therefore some spreading of the virus, and I think that the health experts want time to look at what happens, but I'm going to let Dr. Cohen address that specifically.
Sure. Thank you, Governor, and thanks for that question. Yes, on the 5-week period, we know that school opening is going to happen over a number of weeks over the course of August. And then we want to be able to have a good line of sight after those openings to make sure that we understand which way are our trends heading. Are they going to still continue to be stable or heading downward or going upward? So we know school openings are going to happen over a number of weeks into August, and then we'll have a period of time to be able to look at our trends as we go forward. Thank you.
Next question, please.
Our next question is from Allison Smith with Fox 8.
Hey, Governor. This is Allison with Fox 8. Just with us staying in phase 2, you know, a lot of us have heard or seen bars, gyms operating despite your executive order, bringing in money, saying they're doing so safely. A lot of these places, depending on the area, have gone unchecked from a legal aspect. So I guess what is the incentive for these individuals, these businesses who have been following the rules to remain closed when they look down the street and they see a neighboring bar or gym that's open with no problems?
You let local law enforcement and the Department of Alcohol and Law Enforcement Agency know if one of these things are happening, if a bar is open, because actions have been taken to close those bars, and that action will be taken again. We want to know that. They should not be open, and the reason is the significant chance for spread of the virus. Next question, please.
Our next question is from Dewan Hogard with ABC 11.
Good afternoon, Governor. Dewan Hogard, ABC 11, Raleigh, North Carolina. Just a question for you and Dr. Cohen. Just want to press you a little bit more to be specific. If after these next 5 weeks, if the numbers don't show something appropriate to you, both specifically, how aggressive or how more aggressive do you see you all becoming in getting the states reopened?
One of the things we don't want to do is to go backward. And one of the best ways to prevent that from happening is for people to wear masks and to social distance. The more people who do this, the better off we're going to be and the better chance that we will have to be able to ease restrictions and to move forward like we very much want to do. Dr. Cohen, you want to address that?
Sure. Hi, Dewan. Thanks for the question. Yes, so we will continue to watch the same 4 metrics that we've been watching, looking at our surveillance data, looking at our testing data, and looking at our hospitalizations to understand what is the amount of viral spread that we're having in our communities. We are seeing that first signs of stability. As we go into these school openings, we want to maintain that stability, and I think that's why you hear us saying over and over to do the things we know that work, doing the 3 Ws. But we want to make sure that we can sustain this stability and even better to decline, because I will say our cases are still too high. We are still having such a high clip of cases day over day. It is still straining our resources, with whether that's testing resources, tracing resources, or hospitalizations. We certainly want to see a lower level of new cases spreading across the state here. So I think we know what works. We're going to continue to stick with it. I know it takes a lot of vigilance, but we are seeing our numbers go in that stable direction, and I think it's directly tied to the hard work we've been doing with face covering, so we just encourage folks to continue on that path. Thanks.
Thank you. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. With the timeline and the way things have gone so far, I wanted to ask, do you believe North Carolina will be in a position to move into phase 3 before there's a vaccine for COVID-19?
I hope that we will, because there are ways to control the spread of this virus. If people will do the things that we continue to tell them to do, wearing a mask, social distancing, and washing frequently, we can drive down these numbers. Obviously, we all want a vaccine, and I'm proud of people in North Carolina and companies that are working hard on it, but we would hope that we could move along in our phases even before a vaccine is in effect. Next question, please.
Our next question is from Kate Martin with Carolina Public Press.
Good afternoon, Governor Cooper. This is Kate Martin from Carolina Public Press. I'm wondering if you guys can share what the turnaround time is for test results statewide now. Some people I've been talking to are still reporting 10 to 14 days, and I'm wondering what effect that has on contact tracing and isolation efforts as you're trying to slow the spread of the virus. Also, I'm interested in whether the state is formulating a plan on when a vaccine is eventually available. What sorts of groups of people will have the first access to it? Thank you so much.
We want to reduce turnaround time. We think it's critical to contact tracing. The sooner you know about a positive test, the better chances you have of being able to trace the contacts. We know that different labs are having different turnaround times. I'm going to let Dr. Cohen address that, but it's one of the reasons why we have joined this consortium of other states to explore ways to leverage our buying power or our collective power to be able to get more testing into our states because of the lack of a federal strategy. But I'll let Dr. Cohen address it.
Hi, Kate. Thanks for that question. And you're right in what the governor was saying is that there are certain labs that are seeing higher turnaround times, but overall we're actually seeing turnaround times that are 3 to 4 days for most of our labs. If you isolate out just 1 or 2 of the labs that are having very high turnaround times that are closer to 6 or 7 days, then almost all of our other labs have really worked hard to get down to about 3-day turnaround time. I know LabCorp, our biggest commercial lab, it's here in North Carolina, has brought on new capacity. They've been working hard to clear their backlog and now and they are processing a lot of tests, and so that is very good news for North Carolina. So a lot of really hard work has gone on in the last week or 10 days to really think about diversification of the labs that we're using, types of tests, as the governor said, even thinking about how do we use our purchasing power differently. So what we are seeing is good news on the turnaround time, and we're hoping to continue to see that. So we want to make sure if you need a test, make sure that you go get a test. There's more than 500 sites on our website, many of which are free. So we're very much encouraging folks to go get tested. Thanks.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. Just a couple of questions. One, in this instance, you've seen a level of stabilization or leveling off over the last 7 to 10 days. Given the nature of you're seeing something that I guess you could say is less bad as good at an elevated level, why go as far as 5 weeks instead of maybe another 2 or 3 weeks to see if that leveling off would continue?
We want to make sure about what's happening with our numbers, with schools reopening over the next several weeks. And we are talking about lagging indicators. And this is why the 5-week period was recommended by the Department of Health and Human Services. And I think Dr. Cohen addressed that well earlier. And the other thing, stabilization is good, but as Dr. Cohen mentioned, we've stabilized at a number that's too high. We've stabilized at a percent positive that is too high. So we want to continue to work to drive those numbers down. And we think that staying at Safer and Home Phase 2 will help us do that. We also saw things begin to stable. There was a direct correlation with the mandatory mask order, and we began to see stabilization about 2 or 3 weeks, I guess it was, after that order. And so we know that that's having a positive effect. Next question, please.
Our next question is from Christy O'Connor with WBTV.
Hi, Governor. This is Christy O'Connor from WBTV. Shortly before this press conference started, the RNC did release some health guidelines that they plan to have their delegates follow when the convention is held here in Charlotte. I was wondering if you had a chance to look those over and what your take was on those guidelines that they've issued.
I think our Department of Health and Human Services has received that proposal. I've not personally seen it. Dr. Cohen, would you want to comment on that?
Yes, so I have also not reviewed it myself, but the members of my team have, and I know we've given feedback. They did report to me that there were some very good core principles in there of wearing face coverings for everyone involved in all the events, the thoughtfulness about social distancing, and as well as screening and testing. So I know that overall folks were thought that it was a good plan overall, but I know we did have feedback that we provided to the RNC to make it even stronger. And again, these kinds of plans are meant to reduce risk. We know that any type of gathering of people has risk of viral spread, and all of these safety elements are meant to reduce risk. And again, I think they have those plans on paper. Now we want to see them executed as they move into their planning phases.
Thank you. Next question, please.
Our final question today will be from Itanice McMiller with WFMY.
Hi, Governor. I wanted to know if there's anything more you plan to do to crack down on businesses that are finding loopholes to remain open, such as bars and gyms.
We are continuing to review enforcement policy. The way the law is written, a lot of that rests with local law enforcement. However, we have been able to use our ABC laws, particularly when bars are involved. Retailers have been doing a better job enforcing mask-wearing compliance for people who come in their retail stores. The Department of Health and Human Services has had gotten reports of some businesses that were open that shouldn't have been, and have contacted them to tell them to stop, and that has happened several times. So we are working to make sure that we can increase our enforcement to make sure that what we're doing is working, and to make sure that what we're doing is fair. We want to thank you all for joining us today, and please stay safe and healthy out there. Thank you very much.